The heart transplant team at St. Luke's Mid-America Heart Institute recently performed its 1,000th transplant, reaching a prestigious milestone less than 25 hospitals in the nation have managed to accomplish. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about what sets St. Luke's apart in the region for advanced heart failure and transplant. With me today, Dr. Jessica Heimes, Surgical Director of Cardiac Transplantation, and Dr. Andrew Kao, Medical Director of Cardiac Transplantation at St. Luke's Mid-America Heart Institute. Thank you for joining us.
Thank you for having us today.
Thank you.
Well, Dr. Kao, starting with you, 1,000 plus is such an impressive number. Can you put this into perspective for us? What does this milestone really mean for people in Kansas City and in the larger region?
Just to put it into perspective, there's only 145 programs around the country that do transplants, and that's pediatric and adult. And there's many more hospitals than that, but only 23 have achieved this milestone. We're the 23rd one out of 145 programs that have achieved that. And so that really shows that there's a continuous dedication to taking care of these patients. There are some programs that come and go because of, administration changes or whatever, but we've been continuously providing this care since 1985. When you think of 1,000 patients, that's sort of an abstract number, but think of your loved one that, was told that they may not survive because they have end-stage heart failure. And this really gives them a chance to have a new lease on life and be able to see their daughter go down the aisle, see grandchildren being born, or go to college in some cases for some of these younger folks. And it's really an amazing dedication of the team that makes this possible, but also a generosity of the donor families as well.
Absolutely. Now, Dr. Heimes, what sets our transplant program apart from others in the area?
One of the things that set our transplant program apart from others in the area is the fact that we've been around for a very long time. Our first heart transplant here at St. Luke's Hospital was in 1985, and since then our program has just continued to grow. Not only that, as the people that are involved in this want to continue to help patients in this community. And so because of that, we have a lot of transplant coordinators, cardiologists, cardiac surgeons who really do everything they can to support this program and really care about the outcomes that we have. In addition, our heart transplant program ranks actually 15 in the nation for the number of adult heart transplants we perform. And not only that, as our outcomes are actually very good in this area as well. In fact, our median wait time to get a heart transplant in this program is about a month versus other programs it's about four months.
And Dr. Heimes, another differentiator is the program's excellent patient outcomes. Can you tell me more about how patients do post-transplant?
Our patients do excellent post-transplant, and the reason they do so well is because we have such a great team helping to take care of these patients. As a result, our 3-year outcomes are 36% higher than the national average. Also, our death on the wait list is actually 54% less than other programs.
Now, Dr. Kao, many of these patients receive heart failure care for months or even years leading up to transplant. Tell me a bit about St. Luke's heart failure program and what makes it unique.
Yes, here at St. Luke's, we have a very unique heart failure program where we put together a large group of professionals to take care of these patients. So we have a dedicated nurse practitioner clinic. We have a high-risk heart failure clinic where people who are really sick get very, very close attention from all the practicing providers. And there are a lot of nurses and dietitians and pharmacists, a whole group of people that really help us take care of these patients. And oftentimes we're able to keep them stable for some period of time, but when they're starting to go downhill, that's when we think about heart transplant. And so we really provide a whole continuum of services for people with heart failure. And unfortunately, heart failure is such a misnomer and is a terrible name. I know some places have called their clinics heart improvement clinic, etc. But heart failure is an official diagnosis. We have to use it, and it sort of denotes this, hopelessness. But we provide hope for these patients, and I think it is just so important to do that. We also have access to a lot of investigational protocols where new procedures or surgeries or even medicines are offered to us because we are so active and well known in this area. And so we really provide above and beyond what other groups can provide in the area because we specialize in this, and all of us really put our minds together. We often talk as a group to provide the best possible care for each individual patient.
Great. Now, Dr. Heimes, is there anything else you'd like to add?
One of the things that I think is really important to add when we talk about our heart transplant program is the amount of people that it takes to actually have successful outcomes. A transplant patient is such a complex patient, and as a result, we have such a great team taking care of them. It's not only the cardiologists, the surgeons, the anesthesiologists, but we have an amazing critical care team. We have amazing nurses. We also have some amazing support staff that help us do such a great job in making sure that we're seeing every facet of the patient to make sure that they do well and succeed postoperatively.
And Dr. Kao, what's your final message to those watching?
Well, it is just so exciting to be over this milestone of 1,000 patients. Very few hospitals have achieved this landmark. But, you know, I would be remiss if I didn't thank all the 1,000 donor families that in their time of grief, they were able to offer the organs of their loved ones that make all of this possible. And, you know, really all of these patients have become family as well. And so we celebrate together. And life is so precious. It is just amazing that we're able to do this as a group. And this is not a job. This is a passion and a vocation for us.
Absolutely. Well, thank you both again for joining us, and congratulations to you and your team for reaching this impressive milestone.
Thank you very much.
Thank you.
To learn more, visit stlukescasey.org/1khearts. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukescasey.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.